You're right, we are speaking consistently and constantly, day in, day out, about staying at home. And we're very clear in the reasons as to why. You've all heard us say this, and others across government, CMO, and many others, about the impacts on the NHS. The rules are actually very simple and clear. We are meant to stay at home and only leave home for a very, very limited number of reasons. And that is obviously to go to work only if you cannot work from home. In terms of schools, the schools are open for the children, pupils of key workers. And then, of course, outdoor recreation, but in a very, very restricted and limited way, staying local. I've said that several times over the last week. And obviously people that need medical help and support. And you've heard me speak frequently as well about those that could suffer from violence, domestic abuse, etc. These are very, very limited reasons for leaving. And I think, I can only actually echo the words of Dr. DeWalker. We are in a health pandemic right now. Everyone has to be conscientious in their actions and almost act and behave as if we have COVID, therefore restricting all our social contacts. So the rules are clear. And in terms of police enforcement, we've spoken at length, not just today, but previously, Martin and all my brilliant colleagues across policing, as to the type of egregious breaches that we will clamp down on. So the rules are clear. Martin, do you want to add anything to that at all?
No, I think it is really just to make that point that the stay at home, the reducing contact, I think that is very clear. And certainly from our perspective, we will carry on engaging with people. That's how we have done this from the beginning. We will talk to people and we will explain. But I think the rules are clear enough for people to understand. We are 10 months into this process. And you're right that the regulations have shifted over that period of time as the pandemic has. But I think it's very clear what people need to do. And people need to accept the personal responsibility to act properly to prevent the spread of the virus.